JES Foundation Repair, the Virginia Department of Emergency Management, and the Virginia Department of Health are proud to sponsor this special news presentation.
Welcome back to Virginia Responds. Your questions answered. I'm Constance Jones.
And I'm Juan Condi. We're joined now by Dr. Lori Forlano with the Virginia Department of Health. Dr. Forlano, thank you for being with us this evening.
Thanks.
Our first question is about long-term care facilities.
That's right. Canterbury Health Care and Rehab Center here in Richmond has had one of the deadliest outbreaks in the country. The governor put you in charge of a task force there to address the issues at the long-term care facilities during this pandemic. Our viewer, Jerry, has a question for you.
What have we done to improve long-term care facilities and reducing the risk of COVID-19? With over 90% of the Virginia deaths are people that are 60 plus, I really think we should focus on how to improve long-term care facilities.
All right, so the question again, how are we addressing long-term care facilities, doctor?
Yeah, the population that lives in long-term care facilities is absolutely one of our #1 priorities during this COVID-19 response. The governor has shown that priority by establishing this task force. So far, in about a week's time, we've been able to expand testing to these facilities to ensure that they have access to testing for both residents and staff. We're working through some staffing solutions and support for these facilities, and also helping them work through the right processes so they have access to personal protective equipment, and also some support with volunteers, our Medical Reserve Corps, and other supports for these facilities. We'll continue to keep close tabs on these facilities around the Commonwealth, and it's just an absolute priority for us.
A common practice at those facilities, doctor, is sharing nurses, something Dr. Danny Avula of the Richmond and Henrico Health District said may have contributed to the spread of the virus.
Yeah, what's being done about these practices?
Yeah, it's definitely a complex issue. We have learned that staff are often shared between facilities, and what we're trying to do is ensure that there's information that's shared between one facility and another, so they can talk to their staff, they can educate them about their potential exposure if they're working in a facility with an outbreak, and creating a culture where those staff feel safe sharing that information with their employers, that they can take time off if they themselves are sick. And we're working through those collaborations and solutions together across facilities to try to limit that practice if and where that's possible.
Dr. Forlano, you've worked in many of these facilities. What's your impression on how the doctors and the staff and the residents are holding up?
This is a really hard time for everyone, and I think the families that have loved ones in these facilities are really going through just a heartbreaking moment during this pandemic, and that's why we're really trying to go all in and support these workers and their staff, their leadership, and the families all involved in these facilities to make sure that they have the resources that they need.
All right, let's move on to the next question about testing. A New York Times report shows that Virginia was testing the 3rd fewest people per 100,000 among all the states in the U.S.
Yeah, here's a look at the rankings. Puerto Rico was doing 13, Kentucky 19, Arizona 21 per 100,000. Virginia's there at 23. How are we improving these numbers, and what are the barriers to doing that, doctor?
So I think what Virginia has shown is that as the situation has evolved, so has our approach to testing. Our criteria has changed several times along the response. We've expanded testing to more populations as recently as last Friday, and we're adjusting to the response as it evolves. We recently established a testing task force, which is going to be focused on this issue. We look forward to the increased support from the federal government that we've learned will become available very soon. We really, and the real message to Virginia is the capacity is increasing. It's increasing in our academic labs, our state public health laboratory, and our commercial laboratories as well. And they're all going to work together to assure that we have the capacity that we need.
All right, speaking of capacity, our next question comes from Mary in Chesapeake. Let's listen in.
I tested positive for coronavirus on April the 2nd and have quarantined at home since that time, working remotely. Can you please explain why those of us in the Commonwealth that tested positive are unable to retest to find out if we're negative so we can return to the workplace with confidence?
Dr. Forlano, when would be a good time, or how can we address the concern that viewer had?
Well, first of all, I'd like to just say that I hope she's feeling better and recovering well, and also thank her for staying home while she was sick, because those are really important steps to help prevent the transmission of disease. In regards to testing after you've been diagnosed with COVID-19, there are some situations in which that's really necessary. For example, caring for a seriously ill patient in the hospital that might be going to a nursing home. Sometimes testing helps give doctors information they need. Right now, especially when we have limited testing capacity, we really need to reserve those tests for those who need it the most. We hope that serological testing, which is testing of antibodies, will be available soon, and that will help us test people to determine if they have an immune response to the virus. So we hope that technology and capacity will be able to be available soon.
Our next question, Dr. Forlano, is about modeling and the data that we're using to determine when a peak will come. Let's show you the model from the University of Washington showing that our peak should be in 4 days. There is also a model from the University of Virginia tonight. We're looking at that graphic here that suggests the peak will come a little bit later, perhaps during the summertime.
Yeah, why is there such a difference between these models, and when do you expect the peak?
So different models obviously are showing different timelines, and the reason for that is that they make different assumptions. They may look at data slightly differently or use different variables. I think the important message that we're seeing in the models that we're looking at, particularly the University of Virginia model, is that the social distancing strategies that we have put into place are working. They have slowed the curve, so to speak. They've flattened it a little bit and pushed it out a little further. And if we keep at it, we're hopeful that the capacity of the healthcare system will remain in control. And it's a really heartening sign to know that the hard things that we're having to do right now are seeming to work.
All right, Dr. Forlano, obviously a lot of people are ready for businesses to be reopened. When do you think it'll be safe to do that?
It's a great question. So when can we reopen Virginia? So there are a few things that need to be in place before we move to a full phased reopening of the Commonwealth. Things like making sure we have enough testing capacity, making sure that we're seeing a decline in the number of cases over a pretty sustained period of time, about 14 days. We also need to make sure that our public health workforce is ready and able to do things like contact tracing and case investigations. And we also want to make sure that our healthcare system has the capacity to respond.
All right, our next viewer question is about keeping ourselves protected, our health protected once our economy reopens. This is Meg, a massage therapist in Northern Virginia.
When the restrictions are eased, how can we, one, ensure that the increased risks to licensed massage therapists and our clients is taken into very special consideration?
So again, what can Virginia residents do to make sure that they're safe when they return back to work?
So what can we do to keep safe when we start reopening things in Virginia? We can continue to wear those cloth face coverings or masks that all of us have either fashioned at home or purchased in some way or another. I still think that's going to be an important measure to take, especially in the beginning. I think we also need to think about our gatherings with loved ones and friends and family and coworkers, and maybe keeping those to a smaller size in the beginning. So essentially doing a lot of the things we're doing now, taking a phased approach, a paced approach, and not turning everything on right away, but making good decisions about what's really necessary and what might be able to wait.
And we certainly hope she gets back to work soon. People are losing their livelihoods. A lot of the questions that we've received, Doctor, are about trying to find comparisons between the flu, the regular flu, and our coronavirus, our novel coronavirus.
Yeah, we're now a month into all of this. What are some of the key differences that you've seen?
That's a great question, because some of these symptoms can look very similar. In the beginning, fever, body aches, cough or respiratory symptoms. Some people are also reporting gastrointestinal system symptoms, nausea, vomiting, etc. So in the beginning, it's hard to tell. Obviously, you can be tested for the flu, and you can also be tested for COVID-19, so that's something that can help. Typically with the flu, You might resolve your symptoms a little sooner, but that's not always the case. So I would say just keep an eye on your symptoms. If you're having really concerning symptoms like shortness of breath, you want to make sure that you call your healthcare provider immediately, regardless of the cause of your illness.
All right. Thank you very much. From the Virginia Department of Health, Dr. Lori Furlano, thank you very much for sharing your expertise with us this evening here at 8 News.
Thank you.
And thank you for joining us for Virginia Responds. Your questions answered. I'm Constance Jones.
I'm Juan Condi. Of course, we'll have this all posted online for you, WRIC.com and the 8 News app, plus our social media. Share this information with your friends. Good night.